Hello, my name is Juan Martin. This is for course Keen 353. I'm gonna be doing an ankle taping job today. This is gonna be ankle taping for an inversion sprain. So the taping for an inversion sprain and eversion sprain are different. This is the traditional closed weave basket taping style. So you always want to check when you see the patient in the athlete's foot whether they have rolled their ankle inwards or outwards. So here inversion or here eversion. Now we're going to use this underwrap taping to begin with. This is going to help to not cause irritations for when we tape with the next tape over it, which is going to be the supporting tape. So here we go. Here we're going to begin. So you want to have your patient or athlete's foot kind of in a plantar flex position if possible, so you can have a better angle to tape. So I'm going to begin taping here. I'm going over to this area, the higher part of the ankle and lower leg, and then just coming back down here, and then coming back up again. So that's what we're gonna do. Of course, if you have some spray, it's just gonna help stick, that would be great. Now we're gonna go on to the supporting tape, and we're gonna do a couple of anchors right over here in the top part. Let me just cut this part of this tape that's kind of stuck right here. Okay, so here I'm going to create two anchors. So one anchor. Two. Now we're going to have one anchor also down here. Okay. Now we're going to start off with the Steri-Strips, and you're going to go from medial to lateral since it is an inversion sprain. We're going to go from here, under, this tape seems a little tough. I know you shouldn't be using scissors, but for some reason this tape is not ripping as it should. So we're going to do two Steri-Strips here. String. Then we're going to come here and do a horseshoe. The horseshoe's going to come around from medial to lateral also. There's the horseshoe. Then we're going to do another Steri-Strip. Here. Having trouble ripping it on the lateral side. Then we're going to come back and do one more horseshoe. And we're supposed to do two horseshoes and two Steri-Strips on this aspect. Make sure we secure. Now we're just going to close up the opening part of this here, of this space here. We're going to continue taping this part here until we can close that. And the tape is good here to do that. To make sure the ankle is supported and taped all the way. There we go. I know I'm taping a lot longer than taking a little longer than the video, but I'm not a pro like him yet as the trainer. So that we have that part, that's good. Now all we need to finish up with is some heel locks. So for the heel locks, we're going to start off from the medial portion. So we're going to go around the heel, right here. So we're going to go around the heel, and it's actually going to come back under and finish here. That's the heel lock. And then let me just cut this part. I'm going to do one heel lock on each side. So we're going to start here. Same thing now from the lateral side. We're going to go around under the heel and finish back on the lateral side. Now that should be supported in the heel. We have the anchors, and that should be supported for, that's the taping for an inversion spring. Okay, took a little longer than the video, but I think we got the job done. So I'm happy with that. The patient should be supported now. Now as for managing the sprain, as let me have the camera go up please a little bit. As for managing the sprain, what we want to do is initially you always want to use the method of RICE, rest, ice, compression, elevation, at least for 1 to 2 days. We want to use 30 to 60 minutes. Want to do 30 to 60 minutes every 2 hours for the first couple of days. And usually after the first couple of days, the swelling has come down, we can maybe start off with some exercises. So when we're going to use the other foot here, so just depending on how much tenderness there is or stiffness, we could have the patient just do range of motion exercises as plantar flexion. So you just want to have them go down. Let's have your foot go all the way down and then come back up. And if that's not painful enough, that's plantar flexion. Dorsiflexion, if that's not painful, then we can add a resistance band and we would have them do dorsiflexion. The trainer has me in this situation. I would wrap this around their foot and I would tell them to pull up now, go ahead, then back down, pull up as much as possible. That's dorsiflexion. And the opposite way, I would wrap this around this here, around their foot on this way, either come around or have them hold it, push down now, and that's plantar flexion. And we would do about 2 sets of 10 reps. Try to advance and progress to 15 repetitions, and that may be a third set. As she continues to strengthen, he or she, we would change the color resistance of the band. And those are my 2 exercises for managing the inversion sprains. And of course, there's more exercises as they progress, but that's right now what I would prescribe. Thank you for everything, and hope you liked the video, and that's all for now.